Hello, everyone. The case I'll be discussing is Joe Smart's chronic pain case, which is a very interesting one as it reflects a complex interplay between the physical and psychological factors that are often encountered in chronic pain management. In approaching Joe's case, the focus for next session shouldn't be to should be to manage his chronic pain through the lens of cognitive behavioral therapy, specifically targeting his maladaptive belief and perception about his pain and health. This approach is supported by evidence suggesting the efficiency of CBT in chronic pain management, where psychological factors play a significant role in dealing with it. The primary treatment goal for next session should be to challenge and reframe Joe's negative and potentially distorted cognition about his pain, about his health, and the healthcare system. This involves addressing his beliefs that the medical team has failed him and that his surgery was botched. These beliefs likely contribute to his heightened pain perception and feeling of hopelessness and betrayal, thus exuberating his depressive symptoms. The reason for Joe's view of his situation, can be influenced by his cognitive distortion, like overgeneralization and personalization. Addressing these can help reduce his emotional distress and modify his pain perception. CBT can help Joe develop healthier ways of thinking about his pain, fostering more effective coping strategies. Targeting his cognitive distortion can also address severe depression and anxiety, potentially improve his overall mental health and quality of life. CBT is widely recognized as effective for chronic pain. It addresses both psychological and physical aspects of pain. Research indicates that CBT can alter perception, improve coping strategies, and reduce the psychological burden of chronic pain. Joe exhibits signs of catastrophizing and negative thought patterns about his pain and treatment, which CBT can effectively target. By restructuring these cognitive distortions, CBT can reduce emotional and physical distress associated with pain. Joe's depression and stress, as indicated by his DAS-21 scores, can be effectively managed using CBT dual focus techniques such as behavioral activation, which can address Joe's depression by encouraging engagement in meaningful activities, thereby improving mood and functionality. CBT can be integrated with pain management strategies. Techniques like relaxation training and mindfulness can be incorporated to manage pain intensity and improve his sleep patterns. CBT offers the flexibility to focus on Joe's specific concerns, such as his feelings of being let down by medical professions and his fear of being misunderstood. This modality allows for personalization. It is crucial for me in the next sessions to build, in this session, sorry, to build rapport and engagement in therapy. CBT equips clients with skills for long-term management of their symptoms. This is particularly important for chronic conditions like in Joe's, where ongoing self-management is key in improving quality of life. By focusing on cognitive restructuring and pain education in the next session, I aim to empower Joe with tools to alter his perception and his reaction to his pain. The intervention aligns with evidence-based practice, integrating clinical expertise and patient characteristics. Future sessions should build on this foundation, potentially integrating other strategies such as mindfulness and acceptance and commitment therapy. And based on Joe's progress and feedback, I think it's important to be flexible with our approach and find the best practice that can provide an efficient treatment plan. So clinical characteristics that may intervene is Joe's defensiveness and his perception to his pain. That his pain is purely medical might lead to resistance towards psychological intervention. It is crucial to acknowledge his physical pain and gradually introduce the concept of how mental health can influence pain perception. Depression and sleep disturbance can be a factor, as Joe's severe depression and sleep issues may affect his engagement and energy levels in therapy. Using CBT to incorporate elements that address his like sleep hygiene and behavior activation can be very beneficial for him. Joe has very negative thought patterns regarding his pain and treatment outcomes that may pose as challenges. These thoughts might need to be addressed through cognitive restructuring in CBT, promoting more adaptive and realistic thought patterns for him. Clinical factors that may be a problem. Given Joe's experiences of being let down or feeling let down by a healthcare professional, it's essential for me to build trust and rapport, demonstrating empathy, validation, and consistent care is very crucial in the situation. Um, Joe mentioned of suicidal thoughts, though without intent, it is necessary to carefully monitor how it's going. I should be prepared to adjust the treatment plan, including possible referrals for more intensive care, if a risk factor does become more intense. I should also maintain a more open communication with other healthcare providers involved in Joe's care. This ensures an integrated approach and prevent contradiction, treatments or advice between us. It is important to manage Joe's expectation regarding the outcome of CBT, ensuring that he understands that the goal is not to eliminate pain, but to improve, cope, and to reduce the impact of his life on his life, which is vital. So I must be flexible in adapting the treatment plan to Joe's evolving needs and responses to therapy. This may involve altering session focus, pacing, or CBT techniques based on Joe's feedback and progress. I should engage in reflective practice and seek regular supervision in navigating complex cases like in Joe's. Supervision can provide new insights, ensure enhanced and ethical guidelines are being met, and prevent being burnt out by this. So for Joe's follow-up session with cognitive behavioral therapy, the plan is to involve a structured step-by-step that targets both his chronic pain perception and associated psychological distress. The steps are designed to reflect an integration of the best available research, clinical expertise, and Joe's unique characteristics. So step one is review and report building. Start the sessions with a brief review of Joe's current status and any changes since the last session. Reinforce rapport and trust, acknowledging any progress, attempts that Joe's has made. And during this time, I would be able to get a better understanding of his perception. Psychoeducation is step two. Introduce psychoeducation about his interaction about chronic pain, thoughts, emotions, and behaviors. Explain the CBT model, focusing on how negative thoughts, negative thinking patterns can maintain and exacerbate pain and distress. Step three, identifying negative thoughts and beliefs. Guide Joe through identifying specific thoughts and beliefs related to his pain and daily activities, utilizing techniques like thought records to track these thoughts. Step four is cognitive restructuring. Challenge and reframe negative thoughts using coping restructuring techniques. Work on developing more balanced and realistic thoughts, especially related to his pain experience and self-efficiency. Step five is behavioral activation. Introduce behavioral activation. Encourage Joe to be more engaged in small, manageable activities. Focus on activities that bring a sense of achievement or pleasure to him, which can counteract depressive symptoms. Step six, relaxing and mindful techniques. Teach Joe basic relaxation techniques such as deep breathing, progressive muscle relaxation, introducing mindfulness practice to help Joe become more aware of the present moment, reducing rumination and enhance pain coping. Step seven is pain coping strategies. Discuss and practice pain coping, which includes pacing and use of positive self-talk during painful episodes. Step eight is setting realistic goals, cooperating with Joe to set goals of pain management and daily function. Employ SMART, specific, measurable, achievable, relevant, and time-bound goals criteria. Step nine is homework assignment, like practicing relaxation techniques or complete a thought record. Homework is crucial for applying skills learned in therapy to real-life situation. And step 10 would be to summarize and feedback, summarize key points that we had during the session, encourage feedback from Joe to understand his perception, and also to get his interaction with not just feeling like I'm telling him, but to feel that he's being involved in the step-by-step or in the therapy session. There is a lot of steps to this, but I believe we could cover all of these steps in 50 minutes, in a 50-minute session. Throughout the session, I think it's vital to maintain an empathetic and non-judgmental stance, actively listen to Joe's concerns and validate his experiences. The plan integrates CBT core principles with an understanding of chronic pain, aiming to improve Joe's coping strategies, reduce the impact of negative thoughts and emotion on his pain, and enhance his overall quality of life. Thank you.